This is Linda Larson Schlitz, and I am with Anderson and Associates Counseling and Psychologist Services, and I am really excited today to have my friend Kari Miller, Dr. Kari Miller, who I met about a year ago, and we've been collaborating ever since. Dr. Miller is an educational psychologist. She's going to give you some of her background, but her expertise is in helping people to succeed in their lives and finding those things that they're good at and what they love to do. And I'll tell you, the first time I met her, I was in tears because she made me feel so good about myself and helped me to see that I did have things to offer. So I know you're going to love seeing Dr. Miller and hearing what she has to say. So Dr. Miller, will you take it away from here?
Oh, thank you so much. I sure enjoy being your friend too, I have to say. So our presentation tonight is understanding your child's and yours as well, your own uniqueness through the process of evaluation and assessment. So what we're going to be talking about tonight is what is an assessment, the kinds of assessments that might be performed, and there's so many that I can't address all of them, but we're going to carve out a little slice. The types of professionals that can perform these kinds of assessments, warning signs that you or your child might need an assessment, and then how assessments can improve your life. So first of all, what is an assessment? So it's the process of gathering and interpreting information from all those appropriate sources in order to really deeply understand a person's strengths and also their needs. So the purpose of an assessment is to identify those areas of need so that appropriate supports, perhaps therapy or medication, whatever those supports, educational supports, can be provided. And also to identify strengths because they can be leveraged in order to help a person lead a better life. Now, we can, as I said, lots of different types of assessment, and I've narrowed it down to some of the more typical ones that you would see for a school-age population. They are the psychoeducational or neuropsychological evaluations, the specialized medical functions such as occupational therapy, physical therapy, speech, and developmental optometry. And that's not on the slide, and I'm going to augment that and get the slides to include the developmental optometry, and that'll be the one that will be sent out. And also medical evaluations such as neurological. And I just want to say up front, I am not a medical specialist, so I'm not going to be talking in depth about that. I just wanted to mention that that is something that could be of value in this type of work to identify a child's strengths and needs. Now, what kinds of challenges can an assessment reveal? Well, there are many, but certainly autism spectrum disorders, ADHD and learning disabilities, emotional or social issues, any speech or language disorder, a sensory integration, balance, coordination, or movement problem, or mental retardation or other cognitive conditions like brain injury, dementia, amnesia. These can all be revealed through these types of assessments. And I wanted to just briefly mention that there are levels of assessment. There's a formal and an informal, and you've seen them both, I'm sure. Formal assessments are norm reference tests. They come with standard scores, percentile scores. They compare the person being assessed, the performance of the person being assessed, to a group of hopefully similar individuals of similar or roughly similar background, gender, age. The better the test, the more specific that would be. And then there's the informal measures. They're observations, and that can be conducted by a person giving an evaluation. They'll be observing the person they're evaluating to look for, how the person is performing in ways that can be noted during the examination. And then there's also criterion reference tests. Criterion reference tests are those that determine whether or not you can perform a certain criterion, a certain skill. So like, for example, can you count to 10, or can you factor a polynomial, or can you say the alphabet? In other words, you're not comparing you to other people your age, they're just, these tests compare you to whether or not you can perform a certain activity. Now, who can perform assessments and what kind of assessments do they perform? There are psychoeducational and neuropsychological assessments, which are one of the main foci for tonight. And they're performed by psychologists, neuropsychologists, educational psychologists, and developmental behavioral pediatricians. And they're conducted to determine strengths and weaknesses that'll help individuals address challenges that can be holding them back in educational or in career contexts. And let's talk briefly about the areas of functioning that should be assessed. We have auditory, language, and speech functions. Your ability, and this can also include a medical underpinning, like for example, in the auditory, language, and speech, a hearing test, so an audiologist can determine whether or not your hearing sounds accurately. Then if you have other medical practitioners involved, perhaps you have certain conditions such as Apert syndrome, which is a pretty significant condition, but it can result in things such as cleft palate. So there can be other physical issues that may need to be addressed. At this level, the auditory, language, and speech level that I'm referring to primarily would be done by a speech and language pathologist and also perhaps by a neuropsychologist. Another thing that in these testing, that some functions are addressed by multiple types of specialties. And this is one of those overlays, because all neuropsychologists would be looking at your auditory, language, and speech functions, and your speech and language pathology evaluation would go even in more depth. Then, of course, we should be looking at memory and learning, your ability to learn new material, how fast you learn, and your memory systems in auditory and visual, mostly auditory and visual, but also in kinesthetic or motor channels. They're very essential, particularly as you're learning to write and form letters. It's important that you can remember the motor movements. And then in visual, motor, and sensory processing issues, these are very crucial, especially the visual, because so much brain architecture, or I should say real estate, is devoted to the sense of vision. Vision is a highly important skill for all of us. It's very important in school, as languages as well, certainly, but vision, I think it often gets overlooked on how crucial that is. And then, of course, we all know that attention, concentration, organization, and other executive functions play a key role in being able to learn. Now, if you're not familiar with the term executive functions, that refers to skills such as attention and concentration and organization, and also skills such as planning, being able to prioritize, time management, being able to hold things in memory, call that working memory. What's also called metacognition, that ability to take a look at how you're thinking at any moment in time and ask yourself, am I on the right track? To stay on track with your goal, bring yourself back when you get off track. That's an executive function. The ability to regulate how quickly or slowly you perform a task, for example, based on how important it is to you. Your ability to shift flexibly from one task to another and then begin another task, and then your ability to stay on track and perform the task after you've gotten started. That's task persistence. Then there's also the social, emotional, and behavioral aspects that should be addressed in a comprehensive evaluation. They include your ability to relate to others, form relationships, to self-soothe, to deal with stress, to maintain correct behavioral responses for the situation and for your age. And of course, an academic evaluation would include the basics of reading, writing, and math. And a personal and family history can give a lot of information. And another thing that may be warranted as a separate bullet point would be observations. But often the practitioner who's doing the evaluation will perform an observation in the classroom if it's a child. And certainly as they're evaluating the child, they're looking to see how the child is performing the tasks for added information. Let's turn first of all to the occupational therapy assessments. That's a big need for young children. Occupational therapists perform assessments of daily living skills, and those include the visual, motor, and visual perceptual skills, how well you can see parts of objects and put them together to see wholes, like block designs kind of a thing. And your fine motor development, your strength, dexterity, how well you grasp a pencil. The pencil grip is a key thing that often gets overlooked in school these days. We don't teach handwriting to the extent that we used to, and that's a real shame, because teaching handwriting can really help improve reading and writing facility. And it's also really essential because kindergarten and first grade teachers are missing that developmental opportunity to help a child develop proper motor functioning with grasp and formation of letters. And then also the ability to use your hands, both hands, so bilateral usage of your hands, your strength and endurance and coordination. And what's called motor planning ability, the ability that comes out as a great example is handwriting, your ability to start and continue to perform the letter in a certain sequence of steps and to write a word in a certain sequence of steps. And then occupational therapists also look at self-help skills because they're so related to the way you use your hands and body in a purposeful way, things such as dressing and grooming and feeding. And then they also overlap with the neuropsychologist-psychologist evaluation by assessing some aspects of executive functioning, specifically those related to attention and organization and flexibility. And they also look at self-regulation, how a child calms themselves, how they adapt to their environment, really crucial, and sensory processing abilities. How well you process what the information that's coming to you from all of your senses. So some great examples of this are, like for me, I have a slight sensory processing issue, and it should have been addressed when I was younger, but unfortunately it wasn't. I have to cut the tags out of each of my garments. I can't possibly stand the feeling of the tags. And I have such a time getting my shoes on in the morning because I can't stand the feeling of the seams of the socks. So those are some classic signs that you have a sensory processing issue. Another classic sign is covering your ears when you hear a loud noise. Anytime a siren goes off or a police car goes by, I have to clap my hands over to my ears. My body cannot handle the sensory input. It doesn't deal with it very well. And that's, if your child is experiencing things such as this, it's a good idea to consider an occupational therapy evaluation. Physical therapy assessments are also important. Now, physical therapy doesn't come up as much in the school-age population as occupational therapy does. Physical therapy tends to be much more of a specialty for adults, but so I'm not as familiar with that. But physical therapists address things such as posture, movement patterns, the performance of your muscles, joint motion, and flexibility. So sometimes we do see children have these issues, and so there are physical therapists that do work in schools. Again, it's not as much of a specialty as mine. Occupational therapy, I've worked with many occupational therapists. So so I guess what I would say in general, if you feel that your child is having an issue with motor development, you would consider either an occupational or a physical therapy assessment or both. Speech and language assessments are very crucial. The speech and language pathologists perform assessment of your speaking, listening, and verbal memory skills, of course, but then also things that you might not expect, such as feeding and swallowing functions. So among the things that they look at are pronunciation or articulation of sounds, the physical ability to produce speech, the quality of your voice, whether it's raspy, whiny, nice, the fluency or flow of speech, and of course the swallowing function, and then the understanding, receptive, and producing expressive vocabulary. And whether or not you're using words correctly in sentences, that's the syntax function, whether you use words in a mixed up order or not. And another really crucial, whether you use language for different purposes. Are you able to use questions appropriately? Can you answer questions appropriately? Do you know the syntax and the grammar for creating a question and answer? Can you use language to relate to others? Can you use language to craft a response in school? All of these are different purposes. And then your ability to reason with language. Can you make inferences, for example? Can you identify main ideas? Medical assessments, I'm just going to mention them briefly. Again, not my specialty, but they often come up for a child, certainly for an adult who's experiencing difficulty. A neurological assessment from a neurologist or a pediatric neurologist can assess the physical condition of the brain and the nervous system. And this would be the actual hardware of the brain and nervous system. At the level of the neuropsychologists, I guess they're kind of a crossover, but they're mostly not the hardware, even though they do address that some. They're mostly looking at the software of the brain. In other words, how you remember things, rather than whether your neurons are firing or whether this part of your brain is overactive or underactive. So there can be a real adjunct to having a neurological examination, specifically in instances such as head trauma or severe illness, toxic metal exposure, toxic exposure of any kind. And then, of course, other medical practitioners can really help. Medical doctors for prescription medication, nutritionists and functional medical specialists for dietary changes. And I like alternative medicine myself, and so I'm real familiar with applied kinesiology and other specialties, acupuncture and things such as that, which can have a big impact on your daily functioning as well as your learning. Then, of course, there's licensed counselors and social workers. And I'd like to let Linda speak to that a little bit and tell how licensed counselors and social worker assessments can work.
Well, thanks, Kari. Yeah, it's a little bit different. And counselors and social workers, obviously, we're not doctors. And we collaborate very much with the other professionals. But what we do is we do a lot of those same things. We take the family history, we take the medical history, but we look at things and assess things as far as the mental and emotional, and kind of do, yes, some of that observation as well in talking to people. And it's a lot of historical kind of work that we do when, like working right now, I'm as an outpatient practitioner working with children and families. So it's a lot of gathering information from all of those other professionals because they don't have time. You see a neurologist or a psychiatrist, it's just kind of an, they do their assessment and then you see them in a few months maybe. We're the ones that are kind of on the ground floor dealing with whatever they found out. So we work through all of those issues and try to do some behavioral things. Now, there's a lot of different counselors and social workers. I have worked as a school counselor to begin with. Then I have been an outpatient therapist. And then I spent 15 years as an employment and training counselor. All of them have different functions and different areas of expertise, but all of them really do things. The whole point of all of this is to get people to be functioning in their lives so they can live happily, use whatever gifts and skills and abilities they have to support themselves. Really, it's all about employment and career, because my belief is that if we aren't doing what we are skilled to do, can do, enjoy doing, we are going to be miserable. And if we do get a job that isn't in our niche, we're either going to quit, get fired, or get sick. So I think it's very important that we find how a person fits, and that includes their personality. So that's another thing that we spend a lot of time doing, and doctors don't have time to often assess personality. Some of that is just getting to know people. But there's a lot of assessments out there. I've got a whole list of them on my website. You've got some great tools as well. But that's kind of what we do as counselors and social workers. The difference between the two, I haven't figured it out yet. I'm licensed as both, but social workers tend to have training that is more behaviorally based. They oftentimes will work in the correctional population and deal with social issues more so than the internal historical kinds of things. So that's my spiel, Kari. Thank you for giving me that opportunity.
Oh, that was excellent. That was real informative. Can I ask you, it was real clear that you do informal assessments, observations, and things like that. Do you also do formal assessments, anything that's a norm reference test?
Oh, yes. A lot of the things that we do, especially in the employment and career field, they have to be normed. What I do now as an outpatient therapist, our baseline is the DSM-5. Somebody has come up with all of these things, and we got to be sure people fit into different things. But there's a lot of assessments that go along with that. There's tests for ADHD. There are tests for depression, for for anxiety that we can give people right here in the office to be sure to see if they meet that criteria based on the norms, which is another issue that I have, but that's another day, on how we put everybody in boxes. But it is very helpful, and yes, we have a whole entourage of assessments, and some of them I've got on my website, the mentalhelp.net. There's a number of normed tests on there that people can actually take, but it still doesn't diagnose you. You still need a professional to do that, a licensed professional to do that. So thanks, Kari.
Yeah, absolutely. Excellent. I didn't know that because I tend to focus on school-age population. So that's great to know. Wonderful specialty. Well, let's just briefly address what an informal assessment is. It's things such as observations or classroom tests. And who can give those? Educational therapists, teachers, and of course parents. And then, depending on the age of the person, a self-report. So just in passing to let you know what an informal assessment was. Now let's turn to the signs that your child, or in fact yourself, needs an assessment. And I've got a checklist that you can download at this link, and it's a long link, so I'm going to say it once or twice, and then it'll be in the handout. It's on my website, and what it is, it's my website followed by a slash, and then the title of the post, and every word in the title has a dash in between it. So here we go. So it's MillerEducationalExcellence.com. Say that again. MillerEducationalExcellence.com /warning dash signs dash that dash a dash child dash should dash be dash evaluated. And that was really annoying, I'm sure, to you. It's MillerEducationalExcellence.com, warning signs that a child should be evaluated. So I've got that grouped in areas, and I've put out some of the most frequently seen, most important ones. All of the ones on the website are important, and they're not exclusive and exhaustive, I should say, by the way. So, but that list is longer on the website than it is here. So first area is auditory, language, and speech. So here's some areas that if you notice your child is showing these signs, it might be a real good red flag, well, not a real good red flag, but it is a red flag, and it might be a real good idea to get an assessment. Now, I wanted to say a brief word about who should be doing the assessment, right? It's difficult to say that in isolated cases or unilaterally without more information. The auditory, language, and speech functions are assessed by speech and language pathologists, naturally. They're also assessed by psychologists and neuropsychologists to a little bit lesser degree. And if there's any medical structural issues, they could be addressed by pediatricians. So it depends on the nature of what you're seeing. So those would be the main specialists to be thinking about in terms of an auditory, language, or speech problem. Probably not the entire gamut, but certainly the main ones to come first to mind. If you or your child's had frequent or recurrent ear infections, big red flag, because that affects the brain's ability to hear sounds, which affects the brain's ability to learn phonics. And we often find a lot of phonics problems among kids who've had frequent ear infections. If your child doesn't respond to his or her name consistently, that could be, of course, an ear infection, or it could be an auditory processing problem. It could be an attention issue. It's hard to know what that stems from, but it's just one of those things to keep in mind, alerts you to a problem. If your child doesn't seem to be paying attention to sounds or what's being said, if your child mixes up the sounds in words. Another one is having difficulty following more than one or two oral directions. That, of course, could be a speech problem, but it also could be a memory problem. It certainly could be both. If your child has trouble understanding jokes or humor, and if your child daydreams or tunes out while you're speaking to them or in class, these are all signs that there may be some issue going on that it's worth investigating.
So it could actually be a hearing problem, not ADD. So you can't jump to that conclusion.
Yes, thanks for saying that. That's right. It could be a hearing problem. It could be an auditory processing problem. It could be a language problem. It could be ADHD. It could be anything. It could be some other things. It could be autism. I mean, this is not differentially diagnosing it, because all of the things that we just mentioned there, they tend to have auditory, language, or speech problems that come as side effects with them. So again, it's impossible to know in a particular case what you're looking at. It's kind of like you look at the pattern of things you're seeing, and that can point you in the direction of what would be the best professional to recommend for first evaluating the child. And again, several professionals' evaluations are often necessary to really fully get at the heart of what could be done to help the person. The next area is memory and learning. So if you're finding that your child acquires new skills slowly, more slowly than others his or her age, or needs a lot of repetition, or seems to forget something that he or she has learned already, but hasn't practiced for a little while. I mean, we have this term, summer brain slide, okay? So we all know that we forget things over the summer. But I'm not talking about a long period of time like that. So if your child was doing something and then all of a sudden a week or so later has forgotten how to brush their hair or tie their shoes, okay, no big deal if they're, whatever, 5 or something. But if that happens repeatedly over the next several months and it takes a long time, you learn to brush your hair and then all of a sudden you forget, that's what I'm getting at. In other words, these things that you think they've acquired, but then they seem to not have acquired them. If they have difficulty following more than 1 or 2 oral directions, that could be a speech or language issue, or it could be a auditory memory issue. Could probably be something else too. It could be attention deficit disorder too. It's hard to say. Here's an interesting one. If you or your child can remember that an event took place, okay, I went to a birthday party, but doesn't remember any of the details, or some of the details, or some of the key details, like you don't know who was at the party, or you don't know whose party it was, or you don't know whether there was a cake. Okay, though that's a key factor. That's a red flag that there's some kind of memory issue going on there. And there's one that we see, unfortunately, more and more all the time. This difficulty with being this time sense. So seeming unaware of time. For example, doesn't seem to understand that some things take longer than other things. Like a child who has brushed their teeth and also sat through a full day of school and doesn't realize that a full day of school takes longer than brushing your teeth. It's a pretty extreme example, but that makes it clear what we're getting at with that. Also has a distorted sense of the past. Now, I'm not talking about understands history, because nobody really grasps history, okay? So it's not like we can remember whether one event happened before another, but this is the kind of thing like doesn't realize that their mother was born before they were. This you should expect someone to know. So something that you would expect to know without being taught in a history class, that's a sign of a distorted time sense. Or not really understanding how long it takes to do typical things, like thinking that it takes 5 minutes to drive from here to the other side of the state. Okay, these are red flags that there's a sense of time, which is a brain function. It's a brain function that's affected in certain conditions. It's very affected in autism and to some extent in ADHD, and it may be in other conditions as well, but it definitely is something that should shoot off a red flag for you if you're seeing things like this. The visual, motor, and sensory processing area is so crucial. I've got several slides on that. Vision is a key preeminent skill, and there's just a great deal of the brain is devoted to processing visual information. So it's worth thinking about, and this is one of the specialties that I didn't mention in the slides, and I'll augment them to fix that. So I'll mention that specialty. It's a developmental optometrist. Now, what a developmental optometrist does is assess how well eyes work together to do functional skills necessary for school, usually for school or tasks such as reading. So the eyes need to be able to work together as a team, not with one of them doing its own thing and the other doing its own thing. Okay, they need to be able to work together. They need to be able to shift their focus from near at hand to far in the distance, and they need to be able to do that smoothly. They need to be able to do it together. They need to be able to look together as you're reading. As you well know, we start from the left and we read the words across to the right. That's called eye tracking. So what needs to happen is the eyes need to move together at the same pace without one of them getting ahead of the other, which would cause blurry vision. So as you can see, all these eye skills are absolutely crucial for being able to read. The developmental optometrist can assess if you're seeing any of these signs, and I'll tell you what some of those signs are that you would need a developmental optometrist evaluation for a developmental vision. If your eyes appear to be crossed, or one of them is turned out, walleye. If you see your child turning or tilting their head in unusual positions when they're writing or reading. I once had a mother said, oh, well, she's just a little pixie. But what she didn't realize was that because her child wasn't seeing well out of one of their eyes. So, you know, if your child is holding their head in these unusual positions or laying way down near the desk, this is a red flag that their eyes are not cooperating with them to perform that task. If they have difficulty copying from the board down to their paper, or even from a paper right next to what they're copying, so they're copying near at hand, and they're having difficulty with that. All of these are signs that a developmental vision exam would be warranted. Some other signs that you may have sensory processing or motor or visual issues. If your child gets lost or has difficulty with directions, if they have spatial confusion, like left and right and up and down, under and over, if they have a distorted concept of their body, if they can't point to a part of their body or touch a part of their body without looking at it, if they are looking at a picture of another and have difficulty pointing to certain body parts, that's at a younger age. These things that show that they really don't have a grounded sense of their own body, that warrants an evaluation by an occupational therapist. Some other things, difficulty focusing or making eye contact, poor coordination, clumsiness, being unaware of your physical surroundings, a tendency to cut yourself or hurt yourself or stab yourself with a pencil or knock into things. That could be because you're just not aware of your surroundings. It could be you're clumsy. If you're not developing a clear preference for one hand over the other, or if you're using two hands to do things, you know, like mixed dominance, so like use your left hand for some things and your right hand for other things. Or if you change back and forth, one day you're writing with your left hand, the other day you're writing with your right hand, that's something to keep in mind as a red flag. And you might also see things like excessive risk-taking, jumping and crashing into things. Another one that's often seen is difficulty being touched. You know, like I mentioned, my tag sensitivity and my seams in the socks sensitivity. So, you know, my body easily makes contact with the environment. That's what I like to think of it. So, you know, a light touch seems a little bit stronger to me than it does to other people. But some kids also can't get touched enough. They want you to do things like pile all kinds of pillows on top of them and then lay on them. And they feel better when you do that. This is a sign that you need to get your child to an occupational therapist. If your child has difficulty calming down or getting to sleep, another red flag that they need to have an evaluation. Now that could be from multiple issues. It's impossible to know what that could stem from. An occupational therapist could be who you need to see. A pediatrician could be who you need to see, because you can have difficulty calming yourself down and getting to sleep from a variety of causes. If you find, like me, you cry or cover your ears when you hear loud sounds, even those that you wouldn't think would be very loud, like a vacuum or a toilet or a hairdryer, or you have a major meltdown in a noisy or a crowded location, another good sign that your child is dealing with sensory processing issues. If your child has limited food choices, like only eats white foods, or will only wear certain kinds of clothes, has to cut the tags out or the seams of the socks, or if your child refuses to put their hands in anything that's messy or sticky, or play with mud, and that can also apply to food. Some kids refuse to eat foods that feel sticky, or that there's just something sensorially about them that they don't enjoy the feel of them in their mouth. These are signs that they need to be evaluated. And in those cases, I would say an occupational therapist would be the specialist that I would go to right away. Now we go to the executive function area, which is the attention, concentration, organization, and other types of skills. So if you are seeing that there's difficulty in noticing or attending to details, leading to what we call careless, quote unquote, errors, or trouble sustaining your attention on tasks or even play activities. If you don't find that your child isn't following through, doesn't complete tasks, leaves things half done, if they avoid tasks that involve concentration or sustained attention, at first you might not know why they're avoiding a task, but if over time, if you notice a pattern that the things they're avoiding are the kinds of things that require them to sit still and to really focus, this is a sign that they're having difficulty with that skill. Or if they daydream or tune out. Hey, Linda, just wanted to let you know I'm hearing a sound back there.
Are you?
Yeah.
Wonder what sound. Let's see if there's somebody else that isn't muted. Everybody's muted. What sound are you hearing, Kari?
Well, that was weird. That sounded kind of like water, like a flushing toilet or something, but just want to point it out. So go ahead.
Yeah, go ahead, because there's one other person on, but they're muted. So I didn't flush any toilet. Okay.
Not a problem. If you find your child or yourself fidgety or squirmy when you need to be sitting still, or have trouble waiting your turn, or if your child feels restless or blurts out answers or interrupts, those are other good signs that you may need an evaluation. If you have difficulty shifting gears from one task to another, or organizing materials or belongings, or your thoughts or your words, hard time figuring out what to say. You know what you want to say. I should say it this way. You know what you want to say, but it's a hard time. You have a hard time putting it into words and actually saying it, just like you saw me doing right there. If you find your child procrastinates with tasks or loses or misplaces materials or belongings. And here's another interesting one. It seems to reach what we call a saturation point. So your child's been performing this task accurately, but then all of a sudden it starts to perform the task incorrectly. This is not quite the same as forgetting it. It was doing fine, and then all of a sudden it's just like it went blank. The screen went blank. It's kind of, they're very similar, but those are, again, red flags that there's something going on that would be good to check out. Of course, we have the academic skills, reading, for example, difficulty learning phonics, difficulty learning to sound out the words or to recognize words by sight, like words like could, like learning words like could. They're always trying to sound it out, cowled or something like that. Slow reading speed for his or her age, or difficulty with comprehension. That could be things such as finding main ideas or making inferences. Another one we see often is determining characters' motives. If your child is having difficulty figuring out why a character might have done something, that's a clear red flag. Frequently losing their place when reading. Now, these that I'm about to deal with here are another sign that a developmental optometrist could perform a vision exam that would be developmental vision exam, and that would be warranted. If your child frequently loses their place when they're reading, or they complain that they have a headache, or they get tired when they read, or their eyes hurt, or that the words are moving or jumping or swimming around or floating on the page, clearly a developmental optometrist is the professional you'd want to see in that case. And of course, for writing, if you have messy handwriting, or if you have a hard time learning to make the letters, or if your child has letter reversals after about the age of 7, or frequently leaves words or letters or phrases out when writing, now that could be a vision issue, or it could be an attentional issue. There again, it's not possible to say without more information. Also, if they have difficulty writing their ideas or getting organized and getting those thoughts down on paper, that could come from multiple factors. It could come from not really knowing what to say, which could be a variety of issues, learning disability or autism, or the act of organizing and retrieving the information, which might point more to a memory issue or attention deficit disorder. So again, it's hard to say what that would come from. If you see a large number of capitalization or punctuation errors, if pretty much every word your child writes, the first letter is capitalized, there's another good flag that something's going on there. If you have poor spelling, or frequently spells the same word differently, so it never seems to figure out how could should be spelled, so spells it like 5 different times and kind of cycles around. Those are all flags that you need an assessment. In some of the areas in math, we often don't see too much difficulty in memorizing counting sequences. We see some, but what we mostly see is difficulty understanding what the counting sequence is doing. So if you're counting by 5s, for example, the child needs to understand that when you go from 5 to 10, that means there's 5 new objects, let's say, have been added to the pile. But if the child doesn't seem to understand what's going on when you count 5, 10, 15, 20 and can just do it, but doesn't have any idea how to apply that in any way, that's a big red flag. That's a comprehension issue. If your child has difficulty memorizing math facts, or any other sequences such as the days of the week or the months of the year, that's taking a lot longer than usual for kids his or her age. If your child has difficulty with word problems or any kind of math problem solving, or the visual aspect of lining up numbers in columns and keeping their place when they're doing calculations, those are all signs that an assessment is warranted. Now, I want to go quickly through the social, emotional, and behavioral signs that an assessment would be warranted. Often perfectionism, like frequently erasing things and just has to get that letter just absolutely perfect. And that could create a very slow rate of work production, but can also have slow rate of work production even when you see messy work. So both of those are flagged. Low tolerance for frustration, or aggressive bullying behavior, disrespectful behavior, tactless behavior, says things that are insulting. Often they don't mean to, but may not realize that those are insulting. They can obsess on one thing or another. It's like, I just got to learn everything there is to learn about dinosaurs. And so your child is always obsessed on dinosaurs and won't focus on any other toy. Or can take some object, for example, a pen or a pencil or anything, and just spend a lot of time with that object and enjoying that more than relating to other people. Those are clear signs of an evaluation is needed. Or can be very stubborn compared with other people their age, or tend to be anxious or tense. They might be irritable or trouble getting themselves going in the morning. They could be very slow moving, or they could be excessively tired at the end of the day. These are very big red flags that you need an assessment. Again, not possible to say what that excessive tiredness and trouble getting going could be. That could clearly be attention deficit disorder, because that's one of those signs of attention deficit disorder, those two signs. It could be a physical problem. So it's impossible to say what that is. It could be a sleep issue. So there again, it's warranted though to look into that. And some other signs in the personal and family history area that your child may need an assessment include a family history of learning disabilities, hearing loss, ADHD, and social emotional difficulties, anything that warranted treatment of any kind. That would definitely be a red flag that your child may have inherited those tendencies. Any kind of head injury or long-term illness, particularly those requiring hospitalization. Unfortunately, being adopted is a red flag because is much higher incidence of learning disabilities, attention deficit disorder, and emotional issues in kids who are adopted. If there's been poor prenatal medical care or nutrition, also a red flag for getting an assessment. Or if there's been injury to the mom, injury or illness to the mom or the fetus before pregnancy, during pregnancy, or during delivery, another red sign. Or exposure to toxins, anything in the environment like mold or lead. Or also to traumatic experiences or loud noises. Those can also affect the development of the brain in significant ways. Well, after you get an assessment, what professionals can help you? So if you're a school-aged student, then the school district, you may be working with the school district to get either an IEP or a 504 plan. And in and of itself, that's a multifaceted discussion, but I'd be glad to take any questions if you have on that. Those are complex laws with lots of ins and outs and underfunded by school systems, so you often find yourself in an adversarial kind of position. But I'm glad to talk through any issues there. You can also work privately with educational therapists. That, by the way, is what I do. That's a specially trained educational professional. So I work with students Most of my students have ADHD, one or more learning disabilities, and often an emotional issue. So I help them learn. And with that profile, I have to use differentiated approaches to help them conquer the issues that are standing in their way so that they can learn and achieve commensurate with their intellect and have a real shot at college and a career and a great full life. And then much less trained are tutors, but they feel a need as well. Then there's the occupational therapists, physical therapists, speech pathologists, and developmental optometrists who can really help when you have issues of sensory integration or balance or coordination or speech issues or eye tracking issues, for example. And then you have psychologists and social workers who can provide individual therapy, family therapy, or social skills groups for kids who are having difficulty learning to make friends. And then there's developmental behavioral pediatricians, psychiatrists, and highly trained, and I emphasize that, highly trained MDs to obtain medication to alleviate troubling symptoms associated with conditions like ADHD, anxiety, OCD, or bipolar. And the reason I emphasize the highly trained is in the area of ADHD, there is virtually no training provided in medical school for addressing medicating patients who have ADHD, and certainly not at the young age of children. That's where you want to see the developmental behavioral pediatrician. It's a highly trained medical specialist who deals with these complex medication issues. For example, kids who have autism and ADHD simultaneously. That's a medical knowledge base that you really want somebody who knows what they're doing, because they're going to improve your child's life dramatically, if so. If you're an adult, then one specialty you could work with if you're having executive function issues would be an executive function or ADHD coach. And again, that's what I do. I help women who want to get their time and their tasks managed and lead a more productive life. You could work with psychologists and social workers, again, for individual therapy, couples therapy, family therapy, or group therapy. And again, for adults, occupational therapy, physical therapists, and speech pathologists. I'm not sure that a developmental optometrist would be warranted, but I guess there are some adults who have seen a developmental optometrist, so I guess that's not out of line. And then certainly other medical professionals can certainly help depending on the nature of the issue that needs to be dealt with. So at this point, I'm glad to take any questions you might have.
Let me unmute our guests here. Is there any questions for anyone that is out there? I know normally this is a half-hour show, but Dr. Miller had so much information, so I wanted to include it all. Do we have any questions? There's a lot of information, and I expect there will be some as we go on. I know some of the ones that I even have, Dr. Miller, is
Sure.
some of the things like, you know, I've had children that I've worked with, and I don't even know which specialist to send them to. And like you said, I mean, truly, I've been doing this 25 years. I haven't even heard of some of the specialists that you've talked about, like the developmental optometrist. I don't know if we even have them around here. So what you're saying is that it's a good idea to do your homework and to at least ask who you can go to, or is there someone out there? Now, do you have any idea if insurance covers these kinds of things, and how do you go about getting a referral to go to one of these specialists?
Okay, great. A great lot of questions. So I'll start with how do you know who to go to? Because, yeah, that's tricky. Even specialists would be thinking, okay, well, it could be this, it could be that, it could be that, right? Okay, because the brain can, if you have an issue with your brain, it can show in different ways, or the same symptom can imply different causes.
Right.
We have both of those things to deal with. So what I would do is I would, like you said, do your homework. So I would ask around at school, if it's a school-aged person, and I certainly wouldn't stop there, but I would first ask child's teacher. I would ask special ed coordinator. I would ask the principal. I would ask any parent who has a child that you may know who has the same issue, because I would get a lot of information. And then I would ask any professional that I happen to know, and that could be my neighbor, it could be that there's a support group down the road. I would investigate what groups meet locally that seem to be dealing with those issues. You do have to do your homework, but just ask widely. Go to meetings. It's too important to not have an evaluation. So you can even ask your pediatrician where to start. And the reason I emphasize asking a lot of people is because most people don't know where to send you. So you do have to kind of ask around in order to get targeted into the right direction. The first place you go may not turn out to be right just because that professional says there's nothing going on. If you're still seeing signs, that clearly means there's something up. So it just means you need to find the professional that's geared to be looking for those particular problems.
Yeah, that is great advice. And next week, actually, we are going to be doing a specialty session, and we'll start out on the teleconference, but we're also inviting people up to Merrill, Wisconsin, which is where I work at Anderson's, but they're going to be coming to the Family Resource Center, and we are so excited to have the children's hospitals of Wisconsin are actually, they've developed these resource centers all over the state of Wisconsin at least, and they are wonderful tools. They help parents. They have parenting classes, they have training, they have specialists that actually help you to kind of navigate the system to some extent, and will help to direct you. They know a lot of the resources. That's why they're called the Family Resource Center. And I really hope a lot of people will come out to that and access the resource centers, because we have them all over the nation. And so that would be really, really helpful. So yeah, I just want to thank you, Kari, for, I appreciate you telling us about that.
What a great tip. That's a wonderful resource. Hey, I just realized, Linda, should I put our pictures on so people can watch us talking?
Sure, that would be great. I love that picture that you've got, though. That's really cool.
Well, that's you.
Yeah.
There we are.
And those who are listening by phone can't see us, but when I do put this online, we are going to be, it will be all the video. It will be, you'll get to see the video and the PowerPoint as well if people want that. So it'll be good.
I have no idea what I'm doing here.
Hey, that's okay.
Trying to drag us up higher and I can't get a hold of it. There we go. Okay. There we go. Let's see. Okay. How can I get us so that we're both a little bigger?
Well, you know, I guess as we wrap up here, Kari, we've got almost an hour, and as we kind of wind up the thing here, you're specializing now in working with women with ADHD, which is why I contacted you when I did, because I am a woman with ADHD who struggles with a lot of executive functioning, and you really helped me to try some things that I never knew there were. But you do coaching for women, and the moms that I've been working with, because I'm working primarily with children and moms who are so frustrated with their kids, and lo and behold, many of these moms also have some of the same issues their children did or do, but were never diagnosed and were never treated. And they need a lot of help. And some of these moms don't want to go on medication, understandably. So, you know, that's part of what you do. I also do coaching with my other hat at Faucet of Hope, but that is a real wonderful thing that you have. And why don't you give us your other website for that, Kari, as well?
Sure, I'm glad to do that. Did you want me to address that, whether insurance covers it or not?
Oh, yes, I'm sorry. I got you sidetracked. That was that ADD off on a new tangent thing. So, yeah.
Not a problem. My working memory, hopefully I'll remember all of it. Yeah. So, yes, there are a lot of those specialties that are covered by insurance. And that would include developmental optometrists, occupational therapists, physical therapists, and speech therapists. You can get free help at school with an IEP or a 504 plan, educational therapists and executive function coaches are not covered by insurance. Sometimes if you have a flexible spending plan with your employer or some special plan, you know, if you get a doctor's permission or a prescription, I should say, a doctor's prescription, sometimes you're able to submit bills for certain services such as educational therapy or coaching. But that's very speculative. You'd have to see in advance whether that's the case. And then also, some of these are deductible. But of course, with the tax laws being what they are, you have to have a whole lot of deductions before it even makes any sense to itemize them. Right. So again, I wouldn't count on those things being relevant.
Well, and from what I know about insurance, now that I'm in this field again, they all want you to start with your general practitioner, your family doctor. So that is where most people need to start, but I would go in there armed with the information and the knowledge and the suggestions of where you would like to be referred, because they can't know everything, and that's why we have specialists. So I really appreciate your helping out. And
can I say one thing about medication? I just have to.
Yes.
And we're all entitled to our own unique opinion. My opinion is that if you have undiagnosed ADHD and you get a diagnosis and you go on medication from a highly trained practitioner who knows what she or he is doing, and you work with that practitioner to do what's called titrate the dosage, get the right medication in the correct dose. In more than 90% of the cases, that is life-altering.
Yes. And
I cannot say enough about how important that mindset is.
I would have to agree with you. And there, again, people need to understand that our brains are made of chemicals. And those of us who have inherited chemical imbalances in our brains, it doesn't get fixed without getting a chemical in the brain that fixes that imbalance. And that may be nutritional, it may be vitamins, but it also may be the other kinds of medications that we have on the market right now that we can only get through a prescription from a doctor. So thank you.
You raised an interesting point that I could go at another talk about. But you know why I advocate medication first? Is because it'll level the playing field fast.
Yes.
So that then you can start organizing your life around exercise, sleep, and diet changes. But without that platform of playing on a level playing field, trying to make all those other changes is so stressful.
Well, and I know just from my own personal experience, I wasn't diagnosed with ADHD till I was 28, and I had constant buzzing in my head, constant low-grade headaches all the time. And the day I started on medication, I cried because all of that stopped. I was able to focus and drive and think one thought at a time, and I had not ever done that in my whole life, which explained why I didn't do well in school and why I was always all over the place. Medication isn't a cure-all. It doesn't fix everything, but it certainly did at least let my doctor know, yep, this is the problem. This is at least one of the problems that we need to address. And it has made such incredible difference with some of my students and patients as well, that I agree. I really like to see people at least give it a try and see if it can, if it makes a difference. If it doesn't, fine. But with ADHD meds, you're going to know within the first half an hour if it's going to be beneficial.
Can I weigh in about that? You were really lucky. You got it right off. Some people, the first medication that's tried doesn't pan out. But that's why I say a highly trained person who knows what they're doing and is willing to work with you for the right delivery mechanism in the right dose can change your life.
Yeah. Well, thank you again, Dr. Miller, for your time and your expertise and putting all this together for us. And certainly we will have you back for more stuff because you've got so many things to offer, and we really appreciate it. So thank you.
Thanks. And here's my contact information. My website's drkarimiller.com. And you can also find that article. And so I'll change the slides for you, and I will send them to you, and then you can send them out to anybody who wants them.
Very good. Thank you so much.
Thanks for having me.
All right. Take care.